Welcome to Medical Imaging Tutorials video presentations for cultural diversity in healthcare. Today we'd like to discuss the do's and don'ts for non-Jewish healthcare professionals with Jewish patients. In this video, we are presenting a brief list of points for healthcare providers to keep in mind when caring for patients from different cultures. These are not comprehensive descriptions, but rather practical items that may affect a patient, the family of the patient, and the healthcare team during the patient's hospitalization. We'll begin with something obvious, but it's important and a lot of times something we overlook. If we have a question, we need to ask the patient and the family how we can best provide care for that patient. A very important point to remember, and the first thing that we'd like to talk about, is there is a difference between the Jewish people and Judaism, the religion. In Judaism, the religion, Jews believe that the Almighty chose Abraham to introduce the concept of monotheism into a polytheistic world filled with pagan rituals. It is generally accepted that Judaism is the first monotheistic religion. Jewish people are the ethno-religious group that originated with the Israelites. Yemenite Jews can trace their lineage back to the very first temple. The prominence of Jews as medical practitioners, researchers, and teachers throughout history has continued into our time. When working with Jewish patients, there are three basic things that the healthcare worker should understand. The first of these, of course, is Shabbat, the day of rest. Next, Jewish dietary laws. And finally, the need for prayer and issues of modesty. The rabbi is the arbiter of Jewish law for the Jewish family. The healthcare worker should respect and seek advice from the patient's rabbi. Not all Jews worship and believe the same. There is actually a hierarchy within the Jewish community, and there are approximately 4 subdivisions within this hierarchy. The two largest subdivisions within these groups are the Reform and Conservative. The smaller subdivisions, which are Orthodox and Other. Orthodox being a very strict interpretation, Other being out of the norm interpretation. For the Orthodox Jew, they observe the Jewish laws and traditions, and they accept the rabbi as a religious authority and the interpreter of Jewish law, roles, and obligations. For the largest group, known as the Reform Jewish group, Jewish law is a guidance and not binding. They have a different idea of the Jewish identity and less observance of Jewish tradition. In the conservative Jewish community, there is a wide variation in the level of observance of Jewish law and tradition. Jewish law is interpreted to fit modern society, and the rabbi is an advisor but not an authoritative figure. In the Jewish beliefs, physicians are given permission to heal and moreover are obligated to heal the suffering. Likewise, the sick must seek healing to preserve their lives. Let's take a look at some basic beliefs and practices of the Jewish community. First and foremost, life is to be lived as fully as possible and valued above all else. Next, the human body is a gift from God. Respect and preservation of life are divine commandments. The next two basic principles are very important for the healthcare provider to understand. First, pain and suffering are not an excuse for shortening one's life. Finally, the sanctity of life supersedes quality of life considerations. Both of these last two beliefs impact heavily on the practice of medicine. In the practice of medicine, Jewish law permits the patient to be told the truth, providing that is what they want to hear, and that they are told in a way that is not harmful to them. Next, patients who want information will ask questions and should be answered honestly. The answers to these questions may not be what the patient wishes to hear, but patients can always maintain hope that God will intervene. Finally, Judaism permits that the patient not be told the truth about their illness if the physician or loved one feels that it would be harmful to them or maybe even shorten their life. Healthcare providers are only permitted to withhold interventions that will not benefit the patient. One has an obligation to utilize appropriate interventions to relieve the patient's pain and suffering. In Western medicine, we want to be proactive and we also want to be preventative in our medical approach. But this is not true for the Jewish patient. Jewish physicians do not usually discuss lifestyle changes with their patients. Prevention is on the back burner and someone has to get burned before they are treated. The Jewish secular society deems it reasonable to pay tens of thousands of dollars for a coronary bypass surgery, but unreasonable to pay a few dollars for prevention. So let's take a look at 11 practical points for non-Jewish providers that are providing health care for Jewish patients. One of the best examples we can see for tradition changing how we provide services is what we would call a Sabbath elevator. Most hospitals and most people will find this extremely frustrating if they had a hospital in which the elevator stopped at every floor automatically. But this is exactly what the Sabbath elevator does on Jewish Sabbath and Jewish holidays. Some Jewish patients may strictly observe a rule not to work on the Sabbath, which is from sundown on Friday until sundown on Saturday, or on religious holidays. If so, this religious injunction against work includes prohibitions against using certain tools or engaging in certain tasks, such as those that initiate with the flow of electricity. This can be very problematic. These patients may not wish to flip a light switch on, or even push a button to call a nurse, to adjust a motorized bed, or even operating a pain-controlled pump. These pumps allow the patient to give themselves pain relief on demand. Also, something as abstract as tearing paper may be considered work, so rolled toilet paper should be replaced with an open box of individual sheets. Scheduling also becomes a problem because we should not schedule surgical procedures or other procedures on Sabbath or religious holidays unless they are life-saving. Nor should hospital discharges be planned during such times without the consent of the patient. While these restrictions on work are actually mostly associated with the Orthodox Judaism sect, it is possible that they may be important for any Jewish patient. Jewish holidays are usually highly significant for patients, especially Passover in spring and Rosh Hashanah and Yom Kippur in the fall. These holidays may affect the scheduling of medical procedures and may involve dietary changes. All Jewish holidays run sundown to sundown. Practical point number 3. Jewish patients often request a special kosher diet in accordance with religious laws that govern the methods of preparation of certain foods and prohibit certain foods and combinations being served. During the holiday of Passover, an important distinction is made between food that is merely kosher and that which is specifically kosher for the Passover. Hand washing before eating may have a religious significance as well. Point number 4. Some Jewish patients may have culturally based concerns about modesty, especially regarding treatment by someone of the opposite sex. However, Jewish tradition holds the expertise of medical practitioners in high regard, and this fact may assuage some concerns about treatment by the opposite sex. Number 5 is always a question for any family, and this is the questions about withholding or withdrawing of life-sustaining therapy. Terminating end-of-life care is often a difficult decision, and family members often wish to consult with a rabbi about the specific circumstances and decisions regarding end-of-life care. Practical consideration number 6. After a patient has died, Jewish tradition directs that burial happen quickly and that there is no autopsy. There is an acceptance when the autopsy is deemed necessary, such as a mandate by the medical examiner. Also, the family may request that family member or members or representative accompany the body to the hospital, even to the morgue. Reverence and honor is the Jewish attitude towards the dead. In the Jewish definition of terminal illness, there are 2 recognized states. The first is trafah, which is defined as a prognosis of about 1 year or less, and the second is termed gosis, or dying. Jews believe that every human being is composed of a soul and a body, and when death occurs, both the soul and the body return from whence they came. The soul returns to the Almighty in heaven, and the body returns to the dust of the earth. Another practical point to know when it comes to death and burial is that there may be a request that any amputated limbs be made available for burial. Details should be arranged through the patient's family's funeral home. Jewish religious laws pose a complex set of restrictions that can affect medical decisions, and patients or family's member may request to speak to a rabbi to determine if the requests being made are moral. Exceptions are often made to normal application of religious law when an action is understood in terms of saving a life, such as an emergency surgery during the Sabbath. The value of saving life is held in extremely high regard in the Jewish tradition. Practical point number 9. It is common for Jewish patients to wear a yarmulke or skull cap, especially for prayer, but some people may wish to keep them on at all times. In addition to wearing the skull cap, there may be a request that at least 10 people, a minyan, be allowed in the patient's room for prayer. Another confusing point, number 10, would be a Jewish person need not be religious to be Jewish, and such non-religious patients may observe Jewish religion and its tradition for cultural reasons. The word Jew is commonly used within Jewish culture, but non-Jews should be mindful of its complex historical connotations, by which it can sometimes carry a harsh tone when spoken by non-Jews. This is especially true where the word is used as a pejorative, such as the N-word for African Americans. When working in healthcare, it is always easier to treat patients with respect if you understand their culture and religion. Being unaware of traditions or religious culture can cause some embarrassing moments for both patient and healthcare provider. Thanks for your time, and we look forward to providing more interesting presentations about culture and healthcare professionals in this series.